All right, so we've got this case study about a 13-year-old cat with a whole bunch of neurological symptoms.
Yeah.
Tremors, lethargy, behavioral changes, you name it.
This case is really a good example of how important a really thorough neurological exam and advanced imaging can be.
Absolutely.
So this cat initially presented with a crouched walk pain in the lower back and then a lack of coordination in their hind legs.
Yeah, and the initial test didn't really show anything too specific.
Right.
Like the radiographs, the ultrasound, the blood work, and urinalysis.
Yeah.
Those didn't explain the neurological signs.
Exactly. And then a couple of days later, the cat's condition actually worsened.
Oh.
So it started showing signs of being less aware of its surroundings, and it had an absent menace reflex in the right eye. And this helped the vets localize the problem to the left side of the brain,
Okay.
specifically the cerebrum and the thalamus.
So that's when they decided to do a CT and MRI.
Right.
And that's where things got really interesting.
Absolutely. The CT scan showed two distinct masses inside the skull. One was on the right temporal lobe, and it looked like a plaque, and the other one was on the left side,
Oh, wow.
affecting both the parietal and the medial temporal lobes. This one was round and mineralized and had even caused some thickening of the skull bone around it.
Oh.
But on top of these two masses, they also found a large collection of fluid in the subdural space.
Oh, really?
Yeah.
Which is the area between the brain and the skull.
Yeah, and this subdural fluid was more pronounced on the right side. The MRI characteristics of this fluid were kind of puzzling.
Okay.
It was bright on T2 weighted images, dark on T1 weighted images, and it didn't fully disappear on flow error sequences.
Wow.
Plus, it didn't show any enhancement with contrast.
So they had these two masses and this mysterious fluid collection.
Yeah.
What were the initial thoughts on what this fluid could be?
Well, several possibilities were on the table.
Okay.
At first, they considered a recent bleed, but that was quickly ruled out. You know, the cat symptoms had been going on for a while, and there were no signs of blood breakdown products on the MRI or the brain swelling that you would typically see with an acute bleed.
What about an infection like subdural lymphoma?
That was considered too,
Okay.
but lymphoma usually shows a very distinct pattern of contrast enhancement around the fluid, which wasn't the case here.
Okay, so then they also considered a rare type of tumor called a cystic meningioma,
Right.
which can have fluid-filled areas.
Yeah.
To get more information, they performed a lumbar puncture.
Yeah.
What did they reveal?
Well, the cerebrospinal fluid analysis was normal both chemically and in terms of cell counts. So that didn't provide a clear answer either.
Sounds like they had a lot of pieces of the puzzle, but weren't quite sure how they fit together.
Exactly. And that's where the decision to operate came in.
Okay.
The cat underwent a craniectomy to remove both of the masses.
And during surgery, they were able to get a sample of the subdural fluid.
Yes, and when they looked at it, the fluid was clear. Analysis showed that it had a low protein content and looked like CSF with some blood contamination. But there were no signs of infection or cancer cells.
And the histopathology of the masses confirmed that they were both grade 1 meningiomas.
Yeah.
So good news on that front.
Right.
But that still leaves the question of the subdural fluid. Where did it come from?
That's the burning question.
Yeah, the histopathology ruled out a cystic meningioma. So what else could it be? So we've got these two meningiomas removed, the cat's recovering well, but there's still this lingering question about the subdural fluid.
Right.
What are some of the leading theories about why it was there?
Well, you have to remember that even though we have advanced imaging, we don't always get a complete picture.
Yeah.
One thought is that the meningioma cells themselves, even though they were grade 1, could have infiltrated the dura mater and caused it to secrete fluid.
But wouldn't we expect to see the fluid coming back if that were the case?
That's a great point, and the follow-up MRI 6 months later didn't show any recurrence of the fluid or the tumors, so that theory is less likely.
Okay, so what's another possibility?
Another thought is that as those masses grew, they might have physically separated the dura mater from the arachnoid mater.
Yep.
This separation could have created a space where fluid could collect, sort of like a subdural hygroma.
And since the fluid didn't completely disappear on full-error imaging, they think there might have been some bleeding into the hygroma as well.
Precisely.
Making it a hematohygroma.
And there's one more hypothesis to consider, and it has to do with how cerebrospinal fluid is absorbed.
Are you thinking about those cases where something blocks the normal flow of CSF?
Yes, exactly.
Like in meningitis?
If the meninges were affected in a way that interfered with CSF absorption,
Okay.
it could lead to a buildup of fluid in the subdural space.
So we've got three main possibilities secreting tumor cells, which seems less likely.
Okay.
a subdural hygroma, possibly with some bleeding and impaired CSF absorption due to meningeal involvement. Is there anything in the case report that points to one being more likely than the others?
That's the crux of the matter.
Okay.
The authors of the case report acknowledged that they didn't examine the meninges microscopically, so we can't be absolutely sure about what was happening at that level.
Yeah.
It's possible there was a subtle meningeal reaction that we just can't see on imaging.
So even with all this technology, we're still left with some unanswered questions.
That's the nature of veterinary neurology, but there is another case report the authors mentioned that I think is relevant here.
Okay.
It involved a dog with a very aggressive type of brain tumor called a choroid plexus carcinoma.
I remember reading about those. They can spread throughout the nervous system.
Right, and this dog also had a subdural fluid collection, even though there wasn't a tumor mass directly in that area.
So are they suggesting that the tumor cells themselves were secreting fluid from a distance?
Not necessarily. Their hypothesis is that the tumor cells had spread to the meninges and were interfering with CSF absorption in those areas. It's like the drainage system for CSF was partially blocked.
And if that can happen with an aggressive tumor, could it also be a possibility with less aggressive tumors like meningiomas if they happen to affect the meninges in a certain way?
It's definitely a possibility, and it highlights the complex interplay between tumors, the meninges, and CSF flow.
You know, it's amazing to me how this one case study can open up so many questions and avenues for further investigation.
Absolutely. It reminds us that we're always learning and refining our understanding of the brain.
Well, before we get too carried away with the mysteries of CSF flow, let's get back to the cat in this case.
Okay.
After all, this deep dive is all about understanding how these clinical findings come together to help a patient.
You're right. Let's delve into the details of the imaging findings and what they tell us about what this cat went through.
Sounds good to me. Let's look at those images. Okay, so let's break down those images.
All right.
You mentioned earlier how the right-sided mass effect was significant.
Yeah, that really was.
Can you walk us through that?
Absolutely. So the combination of the mass itself and that subdural fluid accumulation really pushed things around in the brain. You can see that midline shift towards the left in Figure 1A.
Okay.
And in Figure 2, the lateral ventricles look compressed.
Yeah.
Particularly on the right side.
Right. And that compression is a sign of increased intracranial pressure, isn't it?
Exactly. But look closely at Figure 2A.
Okay.
The sagittal T2 weighted image.
Okay.
You can see how the tectum of the midbrain is displaced caudally. And there's some flattening of both the rostral and caudal aspects of the cerebellum.
Oh, wow. I see it now. It's subtle.
Yeah.
But it's definitely there.
It is.
So even though the cat wasn't showing the typical outward signs of increased intracranial pressure, like seizures, the imaging tells a different story.
Exactly. That's why removing those masses and draining that subdural fluid was so important.
Yeah.
It gave the brain a chance to recover.
And speaking of recovery, let's talk about that follow-up MRI 6 months later.
Right. The follow-up MRI showed no signs of tumor recurrence or any further subdural fluid buildup.
That's amazing.
That's the best case scenario.
Yeah, and in Figure 4, you can see some remodeling of the skull where they did the craniectomy.
Yeah.
There's even a tiny artifact that looks like a leftover drill bit shaving.
A little souvenir from surgery.
Yeah.
But more importantly, there's no sign of any residual mass effect. The brain has essentially returned to its normal position, and the ventricles look much less compressed.
It's really remarkable how resilient the brain can be.
It is. This case really showcases the brain's ability to adapt and heal even after going through so much.
You know, as we've been discussing this case, I keep thinking back to all the neurological symptoms this cat was experiencing.
Yeah.
Tremors, lesser-G behavioral changes, even insomnia.
Right.
These weren't just abstract clinical signs. They represented a real impact on this cat's quality of life.
You're absolutely right. It's easy to get caught up in the technical aspects of a case, but we have to remember that there's a patient behind all of this, a patient who's feeling these effects.
And in this case, the cat's symptoms had been going on for months before they received advanced imaging and a definitive diagnosis.
It makes you wonder how many other animals out there might be suffering from undiagnosed neurological conditions.
That's a sobering thought. It underscores the importance of recognizing subtle neurological signs and advocating for our patients.
Absolutely. Early diagnosis and intervention can make all the difference.
So as we wrap up this deep dive, what are some of the key takeaways you hope our listeners will remember?
I think this case emphasizes the importance of a thorough and systematic approach to neurological cases.
Okay.
Don't be afraid to pursue advanced imaging if the initial findings are unclear.
Right. And even when we have all the technology in the world, there will still be cases like this one where we don't have all the answers.
Yeah.
But that doesn't mean we can't provide excellent care and strive to improve our patients' quality of life.
Absolutely. And remember, from Vet Neuro Jar, keep those minds-inspired hearts light and tails wagging.